More than 40 states across the U.S. are experiencing a severe spike in coronavirus cases. Just this week, 8 states shattered their daily case records, while 17 others broke their records last week. The U.S. has reported more than 12.6 million cases of coronavirus since the start of the pandemic. So to put that into context for you, that is nearly the entire state of Pennsylvania. The nationwide death toll is now above 260,000 people and continues to climb. CBS News lead national correspondent David Begnaud has more.
If you were grading it, it would be an F, probably an F minus. It's that bad.
Joel Heitkamp hosts the #1 talk radio program in North Dakota. The former Democratic state senator takes tons of calls about COVID every day in a largely Republican state.
And you have a right to call into this show anytime you want.
Well, the height of hypocrisy in North Dakota right now is how we care for our elderly. If you go into Costco, you go into Walmart, you go into any of these places, they say put your blank mask on, you're going to put it on. But you know what? They're not willing to do that around Grandpa and Grandma after they've been out in the bar. And I can't figure it out.
Just yesterday, North Dakota reported 37 new COVID-related deaths. That is a new high. They have the second highest mortality rate in the world, and some of their hospitals are overwhelmed. That's why the U.S. Air Force has sent 60 nurses to help staff hospitals around the state. In South Dakota, the debate over wearing a mask continues statewide.
I think if we choose to wear it for our own protection, that's on us. But to force us to wear it, I'm against that.
Around 50% of South Dakotans say they do not wear a mask. Kelby Krabenhoff, CEO of Sanford Health, the largest health system in the Dakotas, suddenly retired last night after creating a firestorm this week by saying he wasn't going to wear his mask at work because he had recovered from the coronavirus and was immune. Now, in a statement, his own health system said they had mutually agreed to part ways and that his views didn't reflect those of the company. He also downplayed the seriousness of the pandemic to our Sioux Falls CBS affiliate, KELOLAND.
It's hard for me to say we are at a crisis. That would be misleading from a clinical standpoint.
He is not a doctor, but his chief medical officer, Allison Suttle, is. I asked her, would you classify what is happening here in the Dakotas as a crisis?
I would.
36 hours after she contradicted her CEO on CBS This Morning, he is gone. Dr. Suttle is also calling on South Dakota's Republican Governor, Kristi Noem, to mandate masks statewide. But the governor refuses to. North Dakota's Republican Governor, Doug Burgum, did that 2 weeks ago. As of right now, the Dakotas, both north and south, lead the world on a per capita basis when it comes to the number of people dying from coronavirus every day. That is a fact. It's not an opinion. That is what's happening here in the northern part of the United States. David Begnaud, CBS News, Fargo.
And Dr. Wilbur Chen joins me now. He's a professor of medicine at the University of Maryland School of Medicine and director of the UMB Travel Medicine Practice. He's also the chief of adult clinical studies at the Center for Vaccine Development and Global Health. Dr. Chen, welcome. Thank you so much for joining us. You previously worked on Moderna's phase 3 trial, but have since recused yourself from participating in the vaccine's research in order to become a voting member of the CDC's Advisory Board on Immunization Practices. What made you change roles, and do you believe you can have a greater impact on the vaccine process in your new position?
Certainly, yeah. I take the responsibilities of being on the CDC's ACIP very seriously. This group tries to formulate vaccine policy for the nation. And in order to serve in that capacity, I want to make clear breaks from any potential conflicts of interest. And so my role as an investigator on any of these COVID vaccine trials, I wanted to make sure that I made a clean break and made it transparent to everyone so that there was not the perception of a conflict of interest.
That being said, are you very optimistic about Moderna's vaccine having had that, inside track to it?
Yes, I'm actually equally enthusiastic both for the Pfizer vaccine and the Moderna vaccine. I consider them both in the same vein in that they're both mRNA-based vaccines and they both are showing very similar efficacies. So in many different ways, they are similar.
The CDC, doctor, is discussing a move to shorten the length of time a person needs to quarantine after testing positive for COVID-19 from 14 days to 7 to 10 days. Can you tell us what is driving this change, and do you think it's a wise decision as we see new cases of coronavirus surge nationwide?
I don't have any special insight as to exactly the data, why they want to change it to 7 to 10 days rather than the 14 days. I think that, again, I want to be data-driven and see that information. And perhaps I'm just not familiar with it. But I am concerned that if we shorten that time of isolation, that we could potentially open up more instances where people are still infectious and could transmit that infection and are out earlier rather than they should be. I think there is the competing interest, of course, for the people who are under isolation, that they do want to be able to rejoin society and be free again. But again, I think we need to weigh the risks to the public against that. So again, it may be that I'm just not familiar with the newer evolving data that actually justifies that 7 days.
And just to be clear, because I do think there is still a lot of confusion over this, when someone is exposed to the coronavirus or tests positive to the coronavirus, you can still be infectious for 14 days afterwards, or at least that's what the current research shows us. Is that correct, doctor?
You know, I think that it's showing at least 10 to 14 days, and that's what I'm familiar with. Again, I may not be familiar with more of the newer data that is showing otherwise.
Right.
And if that has come out in the past day or two or even week, maybe it's just the fact that I'm not familiar with it, but I haven't seen those data. So I'd like to have that data be discussed so that I can understand why that decision is being made.
Sure. And it's important for people to know because, especially with this virus, there are so many asymptomatic carriers, it seems. And so it's important for people to understand, even if they don't have symptoms, that they could still be infectious. It seems to me that's a very important piece of this puzzle.
That's a very important piece of the public health message for this whole situation, is that we know that there are people who are asymptomatic or pre-symptomatic. So they really may not even know that they're infected themselves, but they can certainly pass on that infection. And that could land on a person who is highly susceptible and could be hospitalized or die. Again, we want to minimize transmission in our communities. And so a lot of it over the summer especially was driven by these low-level asymptomatic and pre-symptomatic infections that was very common among the healthy young adult population, and that's why we continued to see summer cases, even though we were hoping that we would be getting rid of much of the virus during the summertime.
Right. And is it also your understanding that some of the spread is now coming because people sort of let their guard down in smaller groups? That once you're sort of inside, you think, well, there's only 5 of us here. I know this family well. We can all take off our masks. And that's causing a lot of the spread?
Yes, I think you're right. I think the data is showing that certainly bars and restaurants are one of the locations where we're seeing transmission of these infections. But even small gatherings, relatively small gatherings of 5 or 10, but certainly we're also hearing about larger gatherings of 20 or more that are also causing some of these outbreaks.
And just really quickly, AstraZeneca has also posted positive results of 90% or more efficacy on its vaccine. Are you very optimistic with all of these vaccines on the horizon that Americans could be, vaccinated as early as the spring, or a large group of Americans anyway?
I am enthusiastic. I see that all of these vaccines are continuing to show success. We haven't seen any of the vaccines the leading candidates that we're following in the U.S. Completely fail. So I think that the AstraZeneca vaccine continues to show markers of success. We, of course, want to continue to see what the evolving data is. That was just interim analysis, and we'll see what the final efficacy analysis is. And if that continues to be successful, then that perhaps will be that third vaccine that we might be able to see approved in the U.S. So again, I think that I am enthusiastic.
All right. Well, thank you, Dr. Wilbur Chen, for joining us. We appreciate your time.
Thank you very much, Tanya.